Rabies, a zoonotic disease endemic to Uganda, is growing steadily, with infections climbing in West Nile, with school-going age children being the most affected, despite government efforts to reduce the burden of the disease by 50%. Disturbing figures have emerged indicating an increase in animal bites, rabies infections, and fatality rates in West Nile region.
Last year, when we talk from January to December 2020, we had a total of 327 animal bite cases. Some of them were fox bites, some of them were bites from pigs, others were bites from goats, but majorly they were bites from dogs. We had one case of a bite from a cat, and the teacher, it was a secondary school teacher who passed on also. I attended to them here, but he reported late. So out of this, you find there was 187 males and 149 females. But my greatest point of concern is those under 14 years of age was 151.
Compared to the 18 to 45 animal bite cases in the previous years, the first half of this year has seen 135 animal bites being registered, 73 of whom are children under 14 years. Dr. Willie attributes the exponential rise in the mostly dog-mediated infections to highly porous border points which lack strong animal health care, and the presence of Madiokolo District Game Reserve of Ajayi, which permits unregulated interaction between domestic and wild animals.
Maybe the third and last sensitive point is the one where we host quite a good number of refugees from the DRC and South Sudan. The point important here is that whereas the human refugees that enter into our region through the borders from South Sudan are screened thoroughly for hormone diseases, their animals enter without screening. So there's a possibility that the pets, the dogs and cats they come in with, could be also hosting some of these. This would be a point of entry, which might not be major per se, but it contributes to our rise in cases of animal bites. Now, over the years, we've had an average of between 18 to 42 animal bite cases. When I checked through these instances, many people report, my child was bitten by a dog. Where is the dog? The dog was a stray dog. Definitely you query if this dog bit people around 3 places, different places during the same day, then you query that this is not safe. It is a highly suspicious rabid animal.
Yeah, lack of knowledge about the disease is one of the reasons why the disease is spreading very fast. Second one is lack of personnel to train the disease, to rather manage the disease at all levels. Then the other one is also lack of facility for detecting the disease and all keep the vaccines at the facilities where they are kept. Yeah, so there are quite many other reasons, but these are the most plausible ones we can talk about, which, as I told you, is making the disease now go out of hand mysteriously.
The disease has further been exacerbated by regressive psychosocial attitudes where communities attribute it to witchcraft or resort to traditional medicine, which proves fatal in most cases. Rabies is one of the prioritized zoonotic diseases in Uganda, But patients and health officers in West Nile alike are complaining of inadequate supply of human hyperimmune rabies vaccines.
That initially the district health office had the capacity to budget and administer anti-rabies for the community, and in that case it was somewhere the current stores are. But with the changes in the management, logistics management for under national medical stores, this responsibility was waived and taken to the lower level facilities, especially for the hospitals and health center floors. So as a district, that has had a very big impact on the accessibility of services for people who are bitten by dogs and the rest. Now, since that responsibility was taken to be handled by NMS, that left the district health office and the district veterinary office in a state of limbo.
There are also allegations of some health facilities in West Nile selling the vaccines to patients despite clear prohibition of such acts as stated in the Public Health Act and Immunization Act of 2017. However, medical personnel are vocal on both preventative and curative methods to contain the disease through One Health approach, despite the impact of COVID-19 on the economy.
Impact of this, but I think the way forward to go is not lamentation. We need to get focused. Each body should play their role. The Minister of Health, please come in, do the right thing. Minister of Agriculture, yes, that's where I belong. We should come and do our job. Local governments, please, can't you budget for some of this? Can't you, where is your monitoring team? The political wing, go and see how the health centers are working on this. But above all, I want to see a positive trend, to see the cases are reducing. We want to increase our vaccination range, especially for dogs.
Comments you've made that it's true, some of the facilities have been able to extort money from such clients under the pretext that it's an expensive vial, and that's what we are saying, that let this service be scaled down to a health center 3, so that we can kill that bureaucracy. If somebody can get this at the health center 3 level, a client who received this at a cost will easily complain compared to somebody who has received it in a health center 4 or in a hospital. So the mechanisms or the bureaucracies, the line is very small. This can be reduced and can be addressed, cracked very easily. But at the hospital level, by the time you get to complain to the director or to the medical superintendent, you need a line of other people. So I would recommend that these supplies be scaled down to a health center 3. At least the 3 doses or the 5 doses, the allocation should be at the health center 3 level.
The most affected districts are Adjumani, Zombo, Yumbe, Moyo, Maracha, and Arua. For West Nile Television, I am Mahjub Muzmil.